And to educate us further on prostate cancer, we're now being joined from our studios in Lagos by our health expert, Dr. Joyce Omatseye, who is a medical doctor with a degree in health management from the United Kingdom. Thank you, Dr. Joyce, for joining us tonight in the program, and let's get straight into it. Prostate cancer, most of the time, hardly any symptoms. But talk to us as to how it can be caught early enough to avoid fatality.
So, hello everyone, thank you so much for having me on. So as you said, yes, prostate cancer is one of those cancers that if we detect it early, we can make a difference and actually treat it. And as you said earlier as well, lots of people may not show symptoms very early on. Now, the things that we do to screen for prostate cancer include blood tests, such as the prostate-specific antigen test, which actually detects a protein that is released by the prostate and can actually help tell you whether someone is at risk or detects whether someone has cancer. The second thing that we look at actually is doing a physical examination of the prostate itself. And this is actually using doing a rectal examination to actually test the shape, the size, and the consistency of the prostate. So if you have a hard, craggy surface of the prostate, then we're more worried about having cancer. So in terms of screening programs, it's extremely important that people actually get screened very early on in terms of before they start getting symptoms. And we usually recommend from the age of 50 every year from then on. But if you have risk factors, which I can talk about, then you need to get screened earlier on, so between 40 and 45 years old.
All right, but why should we really be speaking about prostate cancer? Is it such, a terrible condition, statistics, prevalence, etc., doctor?
Of course, yes. So prostate cancer, if we just look at the global landscape of what it is, it's the second most commonly diagnosed cancer in the world, and it's the 5th leading cause of cancer deaths in men globally. So we have 1.4 million men that actually are diagnosed with new cases of prostate cancer, and about 375,000 men that die every year. So as you can see, that's a significant amount. And when we look at Africa itself, we're still the 5th, we have the 5th highest mortality, risk for mortality in prostate cancer. And Nigeria, for Nigerian men, it's still the most dangerous cancer in terms of most common and most deadly. So with these type of statistics, there's no way that we can keep quiet about it. We have to continue to speak about it, create awareness, and detect it as early as possible.
Signs and symptoms.
Right, and of course, looking at this data, quite crazy. 80% of Nigerians who get it might not even survive it because it's detected most of the time when it's already too late. Well, as we wrap up this conversation, what are the treatment options really for prostate cancer, which is really prevalent amongst men, especially black men, looking at the data?
Yes, so there are lots of different treatment options, and as you said, a lot of individuals actually show up later. So you either ignore the symptoms, or people just don't know what the signs and symptoms of prostate cancer actually are. So in terms of treatment, of course, we like to focus on prevention and early detection. When it comes to treatment, if you have a low-grade prostate cancer, so that means it's not advanced, it's not moved anywhere else around the body, so it's not metastatic, then sometimes we actively survey it. So we watch and see how that prostate cancer progresses. But of course, if it's advanced and if it's malignant, then we can do surgery. In surgery, we have open or robotic surgery, we have hormonal therapies that we could do, or radiotherapy. But again, this is a discussion with the doctor depending on what type of cancer they have and what their prognosis and their symptoms have been like.
Okay, tell us quickly, can it be treated here in Nigeria? Do we have enough oncologists, to deal with the situation, particularly because of the rising figures?
Yes, so with Nigeria, there's definitely more focus now on the fact that oncology is a huge part of where our investment in terms of health investment should go. And I think we're actually investing a bit more in cancer research centers and in cancer treatment centers. Unfortunately, at the moment, we do not have enough oncologists and we do not have enough cancer care treatments. But there have been, and it's there is more investments and lots of charities within Nigeria that are actually working to ensure that we're closing this gap and providing budgets and treatment plans and for patients in Nigeria. But we still have a long way to go, and we have to talk about it because it is killing quite a lot of Nigerian men, not just prostate cancer, but just cancer in general.
Absolutely, and seeing that we have less oncologists, I hear from the last data, 4 oncologists to 1,000 people. That has to change. But in the meantime, we'll have to say thank you so much, Dr. Joyce Omatseye, for joining us tonight on the program.